So during the 1980s and 1990s, I spent a lot of time travelling Australia's deserts. We visited a lot of Aboriginal communities and we saw how passionate the people were about the connection to their land, but also how poor the communities were in terms of accessing health services. And so at the time I wondered, could point-of-care testing be used outside the laboratory and outside the hospital and actually in a community setting where there was a very high burden of disease but really poor access to pathology testing. In 1996 we had the first opportunity to trial point-of-care testing in a community outside of the laboratory, and this was with the Umina Aboriginal community at Cooperpedy, and there we were able to conduct a really interesting and successful program about the early detection and management of renal disease in Aboriginal people. Point-of-care testing is pathology testing that can be performed on a small portable medical device in a community or primary care setting outside the laboratory. The testing can be performed by a trained operator and the results are generally available in just a few minutes, so patient management can be immediately enacted following the result of the test. We were able to talk to the government, and the government invited me to put in a submission to manage this new point-of-care testing model for diabetes management. And from that submission, which was successful, we started what's called the Clams program, which stands for Quality Assurance for Aboriginal and Torres Strait Islander Medical Services. It's been funded continuously for 16 years now, and it's grown to a national program involving 190 Aboriginal and Torres Strait Islander Medical Services. We have a Clams Indigenous Leaders team that now work with our management team to make sure the program's always culturally safe. We recently got the opportunity to expand the program and its core elements internationally, so we've set up now an Indigenous point-of-care testing model internationally called the ACE program, which stands for Analytical and Clinical Excellence, and that's now operating in 35 communities in 7 countries around the world. I feel that I've been very lucky in having a significant amount of support from amongst Flinders colleagues at both senior and very high levels to support the point-of-care testing work that we've done here.